At least 250 military personnel will be deployed to aged care homes as almost 1,000 facilities battle COVID-19 outbreaks. Around the country, this is the current state of the pandemic. New South Wales and Victoria each recorded more than 10,000 new cases. Queensland had more than 6,000. South Australia posted 19 deaths, but some of those date back months and have only just been reported now. The average daily number of deaths is still trending upwards, and it's edging closer and closer to levels not seen since the first Omicron wave earlier this year. The surge in deaths comes as a coronial inquest into one of the deadliest outbreaks of the pandemic begins in Sydney.
In April 2020, this floral tribute marked one of the first mass outbreaks of COVID-19. Over a 6-week period, 19 people died at the Newmarch House aged care facility in Sydney. Today, a coronial inquest began. It will examine the care residents received and question why positive, vulnerable patients weren't transferred to hospital.
The problems that occurred in staffing, in communication with families, problems in the management of the home, also significantly impacted on the care of residents.
As that outbreak is investigated, Newmarch House is again battling COVID-19. Anthony Bowe's mum survived the outbreak in 2020 and still lives at the facility. He says the aged care home doesn't have enough staff and care is compromised.
Well, they make mistakes. Say she had a Class A patch on for pain medication and they gave the wrong milligram. I mean, that's a massive breach.
Newmarch's owners, Anglicare, told SBS it wouldn't be commenting on the matters before the inquest. The aged care home is just one of the 983 facilities with ongoing outbreaks. The aged care minister says more than 6,000 residents have tested positive and 3,250 staff are infected. Extra military personnel have been deployed, taking the total number of troops supporting the aged care sector to 250.
Given the outbreaks that we are seeing right now, it is important that Defence plays its part in a national response.
Advocates say, including those away with the flu, 10% of the total workforce is out of action.
Yes, it's fantastic we've got help from the ADF, but those 250 personnel will just touch the edges of the lack of staff that we have in aged care right now.
Aged care providers are calling on the government to fund prevention rather than outbreak response.
You can only get your costs for rapid antigen tests, personal protective equipment, extra staff that aged care services might be putting on if you actually have an outbreak.
The Labor government is planning aged care reform. Minister Annika Wells is expected to introduce 2 bills as Parliament returns this week to ensure a registered nurse is on site at all times and to increase the amount of care each resident receives per day.